Hello everyone, in this video I will be explaining the anatomical position and the characteristics of it, and also the abdominal planes on the bottom, the quadrants. These concepts, as you know, they are important because they allow the healthcare and profession to determine exactly what the location of the pain or injuries there are currently at. We'll be going through all of this and explaining a little more about the anatomical positions. The anatomical position is a reference point that is usually used by doctors, nurses, scientists, or even by us students that we are studying for to go to nursing. It's a set point, it's a reference point for everybody. So everybody is able to determine what are the certain spots in our body or what are our body parts. The characteristics of the anatomical position is that the body is sitting up straight, the head and eyes are facing forward, the arms are resting on each side, and also the palms have to be facing forward, as we see in the picture here. The thumbs point away from the body, and the legs are straight. The feet are flat on the floor. The feet are also slightly apart from each other. Even if a patient is laying down, then anatomical position directions like anterior, posterior, medial, and lateral are still based on this standard anatomical position. Moving forward, we have this body planes of the anatomical position. We have a couple here. The body planes are imaginary flat surfaces that divide each part of the body into sections. First, we have the sagittal plane, which divides the body into left and right portions. If the cut is directly in the middle, it is called the mid-sagittal or the median plane. Then moving forward, we have the coronal, which is a frontal plane. The frontal plane divides the body into the back and the front portions. If it separates the anterior side from the posterior side. And then we have the transverse plane, which is the transverse plane divides the body into superior and lower portions. It separates the superior part from the inferior part. Then we have the oblique plane. The oblique plane cuts the body at an angle. It is less commonly used, but it is really important in medical imaging. Those are the body planes. As we see, we have a couple, which are really important to be able to determine in which area the body is divided into. Moving forward, we also have a really important thing, which is the abdominal quadrants. As you see right here, the abdomen is divided into 4 quadrants using one vertical line and one horizontal line through the belly button. The right upper quadrant contains most things like liver, gallbladder, part of the pancreas, right kidney, and part of the small intestine. And then we also have the left quadrant, which contains the stomach, the spleen, a part of the liver, pancreas, and the left kidney. And then we also have the right lower quadrant right here, which contains obviously the appendix, the cecum, like the ascending colon, reproductive program organs, and a small part of the intestines. And then we also have the left lower quadrant, which contains the part of the descending colon and reproductive organs and the small intestine. In conclusion, overall, we know the anatomical position is used as a universal reference point. Also, the body planes, which divides the body into sections and helps us study or imagine anything that we need to do when it comes down to dividing the body. And also, we have the quadrants, which helps the doctors or anybody determine or locate any pain, like when we have in the right lower, we have the appendix, which a lot of people do go to the doctor, so they determine by using the right lower pain. they will know what that is, the appendix in there. So overall, these are three things that obviously helps us locate certain things in the body when it comes down to our health, which are extremely important as moving into more of the healthcare um healthcare field. And that was it for today. Thank you so much.